what we are looking at here is the fascial layer that is separating the deep porch from the superficial. So what you see here is superficial to this, and that is the intention of this illustration. That this is deep, but superficial to it, we are seeing other so types and contents. This is something we are going to look at shortly. Then a muscle type that is similar to the transverse in the superficial porch would be the superficial transverse perineal muscle, and this is running here. But this is poorly developed as compared to the deep transverse muscle, and it is a small muscle generally, which sometimes might be absent, especially particularly when we talk about a female. It is not well developed. Sphincter urethrae, we've already talked about its course, and in the males, it would concentrate around the prostate. In the female, it is going to create these fiber divisions around the urethra, to cover the urethra with the vagina, compressor urethrae, and then anteriorly some fibers still given off around the vagina. Okay, and this is what we have been talking about in the female. You can see the concentration mainly around the urethra to form the urethral sphincter, and then anteriorly given off, and they are concentrating around the vagina, this urethra vaginalis, and the compressor urethrae that are going to play still a very important role in pressing the urethra onto the vagina. And at the end of it all this would contribute to one, urinary continence. So the same thing they're trying to show us here. The urethra vaginalis and the compressor urethrae. We have another muscle type here, which is in the superficial perineal porch, that is the superficial transverse perineal muscle. Okay, so the superficial porch, perineal porch, and they said this is going to be below the perineal membrane. This illustration can bring it out well. We have the pelvic fascia here, or what we are calling the superficial, the superior perineal fascia, and then the inferior fascia here, or what we are referring to as the perineal membrane, and this gives us a deep porch. So we have been looking at the porch. A vast majority of deep porch covered by the urogenital diaphragm, particularly the deep transverse muscles and then the sphincter urethral muscles. Now, superficial porch bound spirally the perineal membrane, and inferiorly it's bound by the superficial fascia of the perineum. And remember, I would love to add on this because it's important that this is normally continuous with fascia of the abdominal wall. Now, what we want to look at are contents of the superficial perineal pouch. And from this, you can see that we have the roots of the external genitalia, the crus, and the bulbs, and the associated muscles covering them, that is the ischiocavernosus and the bulbospongiosus, both in male and female. Still, in a mid-sagittal section, we can still see the deep pouch between these two green, and the lower green is the perineal membrane, which forms the superior boundary of our superficial perineal pouch, and then the superficial fascia, which forms the lower boundary, is this one, enclosing the scrotum. And on this side, you can see continuous with the fascia of the abdominal wall. So our interest is all the contents here, because these are all contents of the superficial perineal pouch. Let us look at these contents one by one. The corolla of the penis and its associated muscles, the ischiocavernosus, the bulb of the penis and the muscles covering it, the bulbospongiosus. Then we talked of this rather thin muscle, the superficial perineal muscle, similar to what we saw in the deep. We have been seeing the scrotum here covered within this content, and of course the spongy part of the urethra, associated perineal and neurovascular bundle. What you see here is the bulb. In another illustration, we can see the bulb and crus well. But what we mean by the crus of the penis, or the crus of the clitoris, and the bulb of the penis, then the vestibule, it's like that is the attached part of the penis. So the attached part of the corpus cavernosum, we talk about the crus, and then the bulb is also the attached part of the penis, and this is the same for the female when you talk of the clitoris and then the vestibule, and they have associated muscles that cover them. They are not naked. This is a very good illustration trying to show us the three sheets that we have looked at. One, the diaphragm inside here. Remember, the pelvic diaphragm was forming the floor. The floor of the true pelvis, levator, and muscles and coccyx. Then you have a sheet of fascia covering it. the inferior fascia. Then we have another sheet now we have been talking about, the superficial porch. And you can see the superficial porch is being covered by the most superficial fascia, that is the superficial perineal porch, which continues to enclose the scrotal, contents of the scrotum as well. And within here, you can see it has been partly reflected to show some of its contents here, the bulbospongiosus muscles, and on either side, you see the ischiocavernosus, and of course within it, they are covering the roots of the penile tissue. So that is the superficial. And then it is also separating us from deep contents of the deep porch. And these are the contents of the deep porch. You can see the fascia here. So this sheet here is part of the superficial, but now deep is, which has not been reflected, is where you find the deep porch, which is having the deep transverse, a sheet of deep transverse muscles. So you can talk about the sheet of the superficial transverse muscles, another sheet of deep transverse, before you can reach the pelvic diaphragm, a sheet of levator ani and coccygeal muscles. The other thing you should note in all these, that all these are having a contribution around our openings, that they all appear to form a contribution to continence and fecal continence. In the pelvic diaphragm, we had the rectalis, we had the pubal venalis, and enclosing also urethra. The same thing is happening to the deep porch, where we have the sphincter urethral muscles. And we now look at the individual contents of, look at the individual contents of superficial perineal porch. So this has been, the fascia covering here has been removed, the superficial perineal fascia, to show us the muscles. The first muscle we are looking at is this one, the superficial transverse perineal muscle. You can see it is really a thin muscle as compared to the deep transverse underneath it. From the ischiotuberosities, it causes medially or transversely to insert on the perineal body. So it will still offer support to the function of the deep transverse by trying to stabilize or support the viscera, pelvic viscera. Then the other muscles are the muscles covering the crura and the bulbs. The first one is the ischiocavernosus. You see how it is causing, generally with an attachment to the rami of the ischium, a small contribution from the pubis, but its fibers to run enclosing the crura of the clitoris